Good day, beautiful people. So on today, I will be explaining what trisomy 18 is, some of the different characteristics and features of trisomy 18, and the life expectancy of trisomy 18. Trisomy 18 is also called or known as Edwards syndrome. It is a extra copy of the 18th chromosome. All right, so we all have 46 chromosomes or 26 pairs of chromosomes. So with that being said, there is a third one or extra copy of it when you have the trisomy 18 diagnosis. Now, if it is a third copy of the 18th chromosome and it is in all of the cells of the body, it is considered full trisomy 18. But if you have it only in some of the cells of the body, or it's a partial chromosome maybe attached to a different number chromosome, like you could have a part of chromosome 18 attached to the chromosome, number 13, then that could be considered mosaic or partial, or something like that, just depending on your wording of it. And you can look up the different characteristics of it. Those types of trisomy 18 that are not considered full trisomy 18, they have a different life expectancy and a lot of other different features that aren't as severe as your full trisomy 18 or Edwards syndrome. So trisomy 18 or Edwards syndrome was named after the doctor whose last name is Edwards, who actually discovered this disorder in 1960. So some of the characteristics or symptoms of trisomy 18 are low birth weight, a small head and jaw, or also sometimes they call it strawberry shaped head. You have clenched fists, club feet, polyhydramniosis. That's where you have an excessive amount of amniotic fluid. The child usually has lots of heart issues or ventricular heart defects. You have a single artery umbilical cord and low set ears, or maybe even underdeveloped ears. And forgive me, but I don't know the medical term for that, but there is a medical term for that when you have underdeveloped or just partially developed ears. Now, some of the tests that they use to test for trisomy 18 and other chromosomal abnormalities is the NIPT test, and that is typically, that stands for non-invasive prenatal testing, and that's done 10 weeks and up. So you have to be at least 10 weeks for them to do that non-invasive testing, which is a blood test. And you typically get the results for that between 4 to 7 days, something of that nature. Now they do have different types of testing. The type of testing that I had was called Maternity 21, and they have some others, but I'm not familiar with the names of those. The other test that you can have done is called amniocentesis. And that's when they stick a needle into your placenta to get a sample of your amniotic fluid, to test that fluid to see if there are any cells in there that, notate any type of abnormalities or trisomies that may be present. And the third type of testing is called CVS, which is a chorionic villus sampling, and that's where they take a sample of your cells from your placenta and they test that. Now the NIPT test, like I stated, is done 10 weeks and up. Amniocentesis you can get from 10 to 20 weeks, and CVS or chorionic villus sampling you can get between 10 and 13 weeks. So the last thing that I'm going to cover in this video is the life expectancy of children born with trisomy 18. So most of all T18 pregnancies, they end in miscarriages or stillbirths. So a lot of the times you won't even know that that's what the child had, because you would have miscarried, or that pregnancy would have come to an end in most cases. So after that, of those who survive through the third trimester, about 40% of those don't survive labor because they already have the heart issues, the lung issues, which may make it very labor intensive and hard, you know, for their lungs to, you know, give them the capacity that they need to survive something as traumatic as being born, because it is quite a big deal, and it's a job actually being born. It's a lot that goes into that for the mother and the child. So with a child that already has these abnormalities and these, you know, issues, it could be, you know, quite taxing on their little bodies to actually even make it through birth. So 60 to 70% of the children who actually survive labor and being born survive their first week of life. So 60% to 70% of them survive the first week of life once, you know, they're actually born. 20 to 40% of them will survive their first month. No more than 10% statistically actually survive past the first year of life. So those are the statistics when it comes to life expectancy for trisomy 18. And this channel is about our sweet little PJ. So with that being said, PJ lived 2 months, of course, with some medical assistance. However, with that, we must say that he was a miracle and a little warrior for having made it to be 2 months old, making it through, you know, 9 months, making it through being born, making it through the first week, the second week, the third week, 4 weeks up to 2 months old. You know, having that being spent with us was very special, and we thoroughly enjoyed it. Just that time with him and having him in our presence. So he beat the odds in so many ways, and for that I am grateful. And I want to hope and thank you for watching, and hope that this was a blessing to you, that it added some understanding and some peace in some way, form, or fashion, even if it was just to help you understand a little piece or nugget of what this actually is. And I hope to see you all in the next video. Be blessed.